A gynecologist's frank discussion. The health consequences of neglecting self-pleasure. After 60. What if I were to tell you that the act of avoiding self-pleasure in your later years does not just mean that you are missing out on an experience of pleasure? What if it could, in fact, actually accelerate the onset of discomfort, of dryness, of a loss of physical sensitivity, and even cause harm to your overall vitality? Most women over the age of 60 never hear this crucial warning because for many, many decades, no one dared to even talk about this subject openly. But I have seen it happen again and again in my own clinical practice. Women who cease to touch themselves often begin to experience a cascade of physical changes that they mistakenly attribute to just aging, when in reality, it is their body quietly beginning to shut down from a state of profound neglect. I am Dr. Lily Stones, a gynecologist with more than 3 decades of experience dedicated to caring for women through the transitions of menopause and beyond. And today, I want to share something with you that may very well come as a surprise. The practice of self-pleasure in your older age is not optional. It is not something to be embarrassed about, and it is most certainly not just for the sake of pleasure. It is in fact a key and integral part of keeping your body healthy, your circulation alive and well, and your confidence strong and unwavering. And if you choose to ignore it, your body will eventually let you know in ways that you might already be feeling. Think of your body as being like a cherished home. If a particular room within that home is closed off and is never ever used, the air inside of it will inevitably grow stale. The walls will begin to collect dust, and eventually that entire room will begin to feel completely lifeless. Your intimate pelvic area works in precisely the same way. Without the benefit of touch, without regular stimulation, your local circulation will decrease, your tissues will begin to dry out, your muscles will start to weaken, and your physical sensitivity will gradually begin to fade. And when that happens, many women will start to notice the onset of painful intimacy, more frequent bladder problems, a pattern of restless sleep, and even a noticeable decline in their overall mood. Let me give you a clear and poignant example. Margaret, a 70-year-old patient of mine, once confessed to me that she had not touched herself in over 20 years. She had been raised to believe that it was an inappropriate act for a woman of her age. When she finally came to see me, she was dealing with a case of severe vaginal dryness, a persistent sense of physical discomfort, and a constant, draining sense of fatigue. She had come to believe that this was all just a normal and unavoidable part of the aging process. But the unvarnished truth was that her body was genuinely suffering from a state of disuse. Once she began to follow a gentle and consistent routine of self-stimulation, which was paired with some other simple lifestyle changes, her tissues began to soften, her quality of sleep improved, and she said to me, with tears of relief in her eyes, "Dr. Stones, I feel alive in my own body again." And Margaret is by no means alone in this experience. I have met countless women who have expressed the wish that someone had warned them much earlier in their lives that the act of ignoring self-pleasure has very real and tangible consequences. According to the renowned Cleveland Clinic, the practice of regular sexual activity, whether it is engaged in alone or with a partner, works to keep the flow of blood active. It helps to support the strength of the pelvic floor. It actively reduces the levels of stress hormones in the body, and it significantly improves one's overall quality of life. Without this vital stimulation, the exact opposite begins to happen. Your muscles will weaken, your tissues will begin to thin, your sensitivity will decline, and your emotional well-being will inevitably suffer. Now here is the most important part of our conversation. I do not share this information with you to frighten you, but rather to empower you. Because while the risks of this kind of neglect are indeed very real, the solution is, in fact, beautifully simple. The practice of self-pleasure is completely free, it is entirely safe, it is perfectly natural, and it belongs only and completely to you. And even if it has been many years since you have last allowed yourself to explore it, your body still possesses an incredible capacity to respond. So, in today's video, I will reveal to you exactly what can happen if you do not practice masturbation in your older age. I will explain precisely why those changes occur, and most importantly, I will show you how you can begin to reverse them. You will learn about the 3 biggest consequences of avoiding the practice of self-pleasure, and you will discover the gentle, science-backed practices that you can begin to implement today to help protect your body, your sleep, and your precious sense of confidence. But before we dive any deeper into this topic, I would be honored to hear from you. Please be honest with yourself. When was the last time that you thought of the practice of self-pleasure, not as some kind of a secret or a shameful act, but as a genuine and valid form of self-care? Please share your thoughts with me in the comments section. I promise you, you are not alone in your experience. When women tell me that they have actively avoided the practice of masturbation for many, many years, I always gently explain to them that it is not just about missing out on a private moment of personal pleasure. It is about what begins to happen to the body when a vital and important system is allowed to go completely unused. After the onset of menopause, your estrogen levels naturally begin to drop, and as a result, your body comes to rely even more heavily on the processes of circulation and stimulation in order to keep its tissues healthy and resilient. Without this, three major and significant consequences will begin to appear. Sometimes they will manifest slowly and insidiously, and sometimes it can feel as though they have appeared all at once. Consequence 1: vaginal dryness and the thinning of the tissues. After the age of 60, a great many women begin to notice that the experience of intimacy now feels uncomfortable, or that even some simple, everyday activities, like walking for a long period of time or sitting for too long, can cause a sense of irritation. This is not just a matter of your age. It is a direct result of a lack of adequate blood flow. When you take the time to stimulate yourself, a fresh supply of blood is able to circulate through your entire pelvic area, carrying with it the vital oxygen and the essential nutrients that are needed to keep your tissues feeling both soft and elastic. Without that crucial circulation, your tissues will inevitably begin to grow thin. They will become dry and they will become significantly more fragile. The Cleveland Clinic has noted that the practice of regular sexual activity, even when it is engaged in alone, can help to maintain the natural elasticity and lubrication of the tissues. The act of ignoring it means that your body will eventually begin to forget how to stay supple and resilient on its own. One of my patients, Elaine, who was 68 years of age, once told me that she had simply assumed that the experience of painful intimacy was her new normal. But once she began to reintroduce the practice of gentle self-pleasure into her life, she was absolutely stunned at how much her level of comfort had improved. Consequence 2: a weaker pelvic floor and a decline in bladder control. You might not realize this, but the natural rhythmic contractions that occur during an orgasm are, in fact, a form of natural workout for your pelvic floor, the very same group of muscles that are responsible for supporting your bladder, your uterus, and your bowel. When these essential muscles are completely ignored, they will inevitably begin to weaken. And the unfortunate result of that weakening can be more frequent urinary leaks, a loss of your core stability, and even some noticeable changes in your overall posture. According to the National Institutes of Health, NIH, the practice of actively strengthening your pelvic floor can reduce the incidence of urinary incontinence by as much as 70%. The practice of masturbation is one of the most natural ways to engage those very muscles. Without it, many women find themselves feeling deeply embarrassed by the bladder leaks that they had once thought were completely unavoidable. Consequence 3: a decline in your mood, in the quality of your sleep, and in your overall sense of vitality. Here is something that is very rarely discussed. The act of self-pleasure is not just a physical experience, it is also a neurological one. When you take the time to stimulate your own body, it will begin to release a cascade of endorphins and oxytocin, the natural chemicals that are responsible for reducing your stress levels and for promoting a profound sense of relaxation. If you skip this practice entirely, your nervous system will effectively lose an easy, drug-free, and natural way to regulate itself. A great many women over the age of 60 who actively avoid the practice of masturbation will find that they struggle with a pattern of restless sleep, with higher than normal levels of stress, or with a persistently dull or low mood. One of my patients, Ruth, who was 72 years old, once told me that she used to lie awake in her bed until 3 o'clock in the morning, her mind constantly racing. She had never once considered the idea that her body might actually be in need of the calming hormones that are naturally released during an orgasm. But once she decided to try it, the quality of her sleep had improved within a matter of just a few weeks. When you put these three consequences together, the dryness, the muscle weakness, and the lower mood, they can very easily create a debilitating and self-perpetuating cycle. The experience of intimacy can become painful. The occurrence of urinary leaks can create a sense of embarrassment, your level of fatigue can increase, and your self-confidence can begin to drop. All too often, women come to believe that this is just aging, but in reality it is simply the body's natural response to being ignored in a very vital and important area of its self-care. Now here is the most hopeful part of our discussion. None of these changes are in any way irreversible. Your body is incredibly resilient. With the implementation of the right kinds of practices, such as gentle self-stimulation, regular pelvic floor exercises, proper hydration, and good nutrition, you can absolutely restore your sense of comfort, you can strengthen your muscles, and you can even improve the quality of your sleep and your overall mood. In the next part of our conversation, I will share with you how the practice of masturbation after the age of 60 can actually work in your favor. I will explain to you the proven health benefits that the science fully supports, and I will show you how a simple, consistent, and gentle routine can help you to feel more comfortable, more energetic, and more vibrantly alive. But first, I would like to ask you, of the 3 common consequences that we have just discussed, the dryness, the weak bladder control, or the restless sleep, which one of these do you think affects women the most after the age of 60? Please share your answer with me in the comments. You may find that you are not at all alone in your experience. Now that we have talked about what can happen if you choose to completely ignore the practice of self-pleasure after the age of 60, let's now shift our focus to the much more hopeful side of this particular story. Because here is the profound truth. Your body does not ever completely lose its ability to respond. Even after the onset of menopause, and even after many years of silence, the act of stimulation can still work to reignite your circulation, to rebuild your sense of comfort, and to restore your innate sense of vitality. The science, the personal stories of my patients, and my own decades of clinical experience all show that the practice of masturbation after the age of 60 carries with it a host of profound benefits that extend far beyond what most women could ever possibly imagine. Benefit 1. Healthier circulation and a greater sense of comfort. Every single time that you take the time to stimulate yourself, the flow of blood to your pelvic region will naturally increase. This vital circulation is responsible for carrying a fresh supply of oxygen and essential nutrients to your tissues, which helps to keep them feeling flexible and works to reduce the incidence of dryness. According to the Cleveland Clinic, women who are able to maintain some form of regular sexual activity, even when it is practiced alone, will consistently report a lower level of discomfort and a greater sense of elasticity in their vaginal tissues. Think of it as being like the process of watering a beautiful garden. When the soil in that garden is well nourished, the plants that grow in it will flourish, but without that essential water they will inevitably begin to wilt. The practice of self-pleasure is that very same essential water for your intimate health. Benefit 2. A natural and effective form of stress relief. The act of masturbation is known to trigger the release of endorphins, which are your body's own built-in feel-good chemicals, as well as the hormone oxytocin, which is sometimes referred to as the bonding hormone. Together, these powerful neurochemicals work to calm your entire nervous system, to lower the levels of stress hormones in your body, and to effectively ease any feelings of anxiety. The Mayo Clinic has highlighted how the experience of orgasm can actually work to reduce the levels of cortisol in the body, the primary stress hormone that has been linked to an increase in belly fat, to a pattern of restless sleep, and to high blood pressure. One of my patients, Carol, who was 67 years old, once told me that she had begun to use the practice of gentle self-stimulation after she had experienced some particularly stressful days, and she affectionately referred to it as her free therapy session. Benefit 3. A better and a deeper quality of sleep. The issue of insomnia is one of the most common complaints that I hear from women who are over the age of 60. The practice of self-pleasure can serve as a completely natural and effective sleep aid. The hormonal shifts that occur during an orgasm will help to relax your muscles, to slow down your heart rate, and to make it much easier for you to drift off into a deep and restorative state of sleep. A 70-year-old patient of mine, Diane, once admitted to me that she had not been able to sleep through the entire night in many, many years. After she began to embrace the practice of self-pleasure just before she went to bed at night, she came back to me and said, "Dr. Stones, I am finally able to wake up in the morning feeling rested, instead of feeling completely exhausted." Benefit 4. The preservation of your physical sensitivity and your capacity for intimacy. Without the benefit of regular stimulation, the delicate nerve endings in your pelvic area can begin to become less responsive over time. As this process continues, women may begin to feel a sense of numbness or a feeling of being disconnected from their own bodies. The practice of masturbation can help to keep those vital pathways alive and well, thereby preserving your physical sensitivity. And here is something that many women find to be quite surprising. the practice of self-pleasure will often work to enhance your experience of intimacy with a partner. By knowing what feels good to you on your own, you will be in a much better position to be able to communicate your needs and your desires. You can help to reduce any feelings of anxiety, and you can bring a much greater sense of confidence to your relationship. One of my married patients, who was in her late 60s, once told me, "The act of rediscovering my own body was the very thing that gave me the courage I needed to be able to reconnect with my husband. It completely changed everything between us." Benefit 5. A stronger and more resilient pelvic floor. The experience of orgasm is not just a pleasurable one, it is also a form of exercise. The natural rhythmic contractions that occur during an orgasm will work to strengthen your pelvic floor, the very same group of muscles that are responsible for supporting your bladder, your uterus, and your bowels. The National Institutes of Health, NIH, has reported that the regular activation of the pelvic floor can help to reduce the incidence of urinary leaks and can also work to improve your core strength. For women who are over the age of 60, this is an absolutely critical benefit. Ellen, who was 71 years of age, once confessed to me that she was deeply embarrassed by her frequent experiences of bladder leaks when she was out on walks with her friends. After she began to combine the practice of her regular pelvic floor exercises with the practice of gentle self-pleasure, she proudly told me, "I no longer have to live in fear of having any accidents. I feel as though I am in control of my own body again." When you put all of these incredible benefits together, the better circulation, the lower levels of stress, the deeper quality of sleep, the preserved sensitivity, and the stronger muscles, you begin to see a picture that has absolutely nothing to do with indulgence, but rather is a form of powerful and effective prevention. It is not just about a fleeting moment of release, it is about fueling your body with a form of natural medicine that costs you nothing, that carries with it no negative side effects, and that belongs entirely and completely to you. Now you may be wondering to yourself, "Dr. Stones, how can I possibly start this practice if it has been many years or if I have never even allowed myself to do it before?" That is exactly what we will be talking about in the next part of our discussion. I will guide you through some safe and comfortable ways to begin. I will show you how to avoid any potential discomfort, and I will teach you how to make this a gentle and a joyful part of your overall wellness routine. But before we go there, I would be so honored to ask you, which of these 5 powerful benefits feels the most important for you right now? Is it the promise of better sleep, of less stress, of improved intimacy, of stronger muscles, or simply of a greater sense of daily comfort? Please leave me a comment below. Your answer just might be the very thing that helps another woman to realize that she is not alone in her desires. I want to share with you the story of Helen, a 72-year-old grandmother who sat across from me one afternoon with tears welling up in her eyes. "Dr. Stones," she said to me very quietly, "I feel completely invisible in my own body. I have not felt alive down there in many, many decades. I had just assumed that it was all over for me." For many years, Helen had been living with a sense of persistent discomfort, with the issue of bladder leaks, with a pattern of restless nights, and with a dull, pervasive sense of being disconnected from herself. She had been told by her friends, and it had even been hinted at by her family, that the experience of intimacy after a certain age was simply irrelevant. But as we began to talk, I explained to her that the act of ignoring her own body was much like the act of closing the door to a room in her own home. "Helen," I said to her, "I want you to imagine a beautiful and sunlit room in your house that you decide to lock up and to never ever use. At first it will just begin to collect some dust, but then the air inside of it will begin to grow stale, the light will start to fade, and eventually that entire room will begin to feel completely lifeless. But the truth of the matter is that the room itself was never actually broken. It was simply waiting for you to come and to open the door again. That room," I told her, "is your own intimate self." Helen looked at me with a great deal of doubt in her eyes, but she eventually agreed to try. She began very gently, with just a few minutes of self-stimulation a couple of times a week, which she paired with some simple and mindful breathing exercises. Slowly but surely, her body began to respond. At her follow-up visit just 2 months later, she was sitting up much straighter in her chair, and there was a noticeable spark in her eyes. "Dr. Stones," she whispered to me, "I am now able to sleep through the entire night. I no longer dread the idea of intimacy, and most importantly of all, I feel as though my own body belongs to me again." Her story is so incredibly powerful because it clearly shows that the human body does not ever forget, it simply waits. Even after many years of silence, and even after many decades of living with a sense of shame, your own body can still be reawakened. The nervous system is able to remember. The tissues are able to respond. The muscles are able to strengthen. and the light in that locked room can be turned back on. Another one of my patients, Patricia, who was 69 years old and had been widowed for nearly a decade, once told me that she had thought that all sense of intimacy had died along with her husband. But when she finally allowed herself to explore the practice of masturbation without any sense of guilt, she said that it was like finding a forgotten part of myself. For her, it was not just about the experience of pleasure, it was about her own sense of independence, it was about her self-confidence, and it was about the profound knowing that her own well-being did not have to depend on anyone else's permission. And this is the very analogy that I would like for you to carry with you. Your body is not some kind of an abandoned house, it is a living, breathing, and vibrant home. When you choose to close off a room within that home, the air inside of it will inevitably grow stale. But when you are able to open that door, to let in some fresh air, and to switch on the light, the entire house will begin to feel completely different. The practice of self-pleasure is the act of opening that very door. It brings a sense of circulation, of warmth, and of life back to a part of yourself that was never truly gone in the first place. I know that for a great many women, even just talking about this subject can feel quite bold, and perhaps even a little bit uncomfortable. But please remember, the act of being bold is exactly what helps to keep us growing, even in our 60s, our 70s, and beyond. Helen's incredible courage to open that door for herself completely transformed her daily life. And yours can too. So if you have been actively avoiding yourself out of a sense of habit, of shame, or of silence, please let this be your gentle reminder: your body is still yours. It still longs for a sense of connection, of touch, and of care. And you are never ever too old to give yourself that precious and life-affirming gift. In the final part of this video, I will recap everything that we have covered: the many risks of ignoring the practice of self-pleasure, the profound benefits of embracing it, and the simple first steps that you can take to start this practice safely and comfortably. And I will leave you with one final hopeful message, that no matter what your age may be, a sense of vitality is still absolutely possible for you, if you are simply willing to turn the key and to open that door. But before we go, please allow me to ask you, if you could unlock just one part of your life again, a better quality of sleep, a greater sense of comfort, a lower level of worry, or simply a feeling of being more alive, what would you choose first? Please share it with me in the comments. We have come full circle in today's important conversation, and I would like for us to pause for a moment to reflect on what we have uncovered together. We began with a rather difficult truth, that the act of ignoring self-pleasure after the age of 60 does not just mean that you are missing out on an experience of intimacy. It can also lead to a sense of dryness, to weaker pelvic muscles, to a pattern of restless nights, and to a feeling of fading connection with your own body. Far too many women will mistakenly attribute these changes to just aging, when in fact they are often signs of a form of neglect, signs that your body is quietly and desperately asking for your care. Then we began to explore the other side of this story, the powerful and life-affirming benefits that can come when you begin to embrace the practice of self-pleasure as a genuine form of self-care. From a healthier state of circulation, to a reduction in your stress levels, from a deeper quality of sleep, to a preservation of your physical sensitivity, and even to the development of stronger pelvic floor muscles, the science on this matter is abundantly clear. The practice of masturbation after the onset of menopause is not something to be ashamed of. It is a form of medicine, it is a form of prevention, and it is a path to a greater sense of vitality. And we heard the inspiring stories of women like Helen, who was able to unlock a room in her own body that she had thought was closed off forever, and of Patricia, who was able to discover a profound sense of independence and confidence through the practice of self-care. These women are the living proof that it is never ever too late to reclaim your own body and your own energy. So what does all of this mean for you? It means that your body is still very much alive, it is still incredibly responsive, and it is still wholly deserving of your attention. If you have been carrying with you the heavy weight of old and outdated taboos, I want you to know that you are not alone, and that you are not too late. Whether you have actively avoided the practice of self-pleasure for many decades, or you have simply never thought of it as being essential, you can absolutely begin today. Here is my personal invitation to you for tonight. Please find a quiet and comfortable moment for yourself. Let go of any feelings of guilt. Breathe deeply and slowly. Begin to explore your own body with a gentle touch, and simply notice how your body responds, not with any sense of judgment, but with a feeling of curiosity and profound compassion. Please remember, there is no right or wrong way to do this. This is all about the process of reconnecting with yourself in the way that feels the very best to you. And if you find yourself feeling more relaxed, more rested, or more deeply connected as a result of this practice, please remember that this is not a mere coincidence. That is your own body thanking you for the kind and loving care that it has always deserved. If this message has resonated with you, I warmly encourage you to share this video with a friend, a sister, or a loved one who might also be able to benefit from hearing these important truths. Far too many women who are over the age of 60 are still living in a state of silence, thinking that their bodies are somehow finished. Together we can work to change that conversation. And please do not forget to subscribe to this channel, Elder Care Wellness, for more evidence-based guidance from me, Dr. Lily Stone. Every single week, I share practical, science-backed solutions that are designed to help women over the age of 60 to age with a sense of confidence, of energy, and of profound joy. Now I would be so honored to hear from you. Which part of today's video struck you the most? Was it the discussion of the risks of ignoring self-pleasure? Was it the surprising benefits of the practice? Or was it the personal stories of the women who were able to reclaim their own vitality? Please leave your answer in the comments below. Your voice truly matters, and it may be the very thing that gives another woman the courage she needs to take her own first, brave step. I'm Dr. Lily Stones, and I thank you for your time. And before we close, let me remind you this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.